Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
When students entered dental school only a few short years ago, dentists didn't advertise, retail dental clinics didn't exist, and closed panel clinics were small in size and few in number. There also were far fewer dentists competing for a proportionately smaller patient pie. In short, just a few years ago, dentistry was virtually synonymous with private practice and property. Today, it is not. During the past decade, significant changes have taken place in the organization, financing, and delivery of dental care in the United States. Although it is estimated that only 2% of all dental care is provided through non-traditional delivery systems, it is expected that these alternative practice modes and settings will increase in the future. The reasons behind the growth of alternative delivery systems are varied and complex. However, several factors appear to have had a significant impact, including the success of the dental profession in promoting preventive techniques, a significant growth in prepaid dental care plans, an abundant supply of dentists, increases in dentists' productivity, and increasing interest by consumers in the provision of dental services, to name a few. Perhaps it will be quite interesting to consider now, some chronicler 40 years from now might comment on the editorials and letters to the editors in our current dental journals. Many of these commentaries oppose practices that by the year 2024 may well be long-established commonplace realities. For example, expanded duty auxiliaries, national licensure, systems of peer review, and specified locales for establishing dental practices, perhaps even the employment and supervision of denturists by dental practitioners. No doubt many will argue that the innovations just named, or for that matter any others, can and should be prevented if we are not to destroy the future of the profession we know today. While such concern is no doubt proper, one may question why we must consider this transformation as some form of disaster. True, the dental profession has been good to us. Economic and social rewards, satisfaction exercising our skills, and many other more intangible benefits have become a way of life for us. However, we delude ourselves with the thought that these efforts for change come solely from inside, from uninformed or misguided politicians, financially motivated third parties, consumer advocates, or entrepreneurs out to get us. This attitude that we and they form two monolithic, directly opposing blocks have effectively masked the reality that much of this calls for change, and indeed the direction for change has come from within dentistry. For example, the need for some reordering of priorities in the selection of practice sites to somehow better distribute practitioners has been embraced by the American Dental Association. In addition, the ADA has taken the leadership in establishing systems for peer review as it revamped its principles of ethics to obligate practitioners to report instances of gross and continual faulty treatment. As to the legislative pressure for change, there is no question that to some extent the publicity generated by congressmen regarding the problems and abuses on the delivery of health services is politically motivated. A prominent example is the excessive publicity about the Senate report, Frauds and Abuses Among Practitioners Participating in the Medicaid Program. While we may argue that this fragment of the health delivery system is not representative of the entire field, the damage to the health profession's public image has been done. However, we should acknowledge also that the resistance of the dental profession to the well-documented value of proposed changes in healthcare delivery has, to some extent, encouraged adverse publicity. Congressional leaders are certainly aware of this resistance. For example, Senator Williams, chairman of the Senate Committee on Labor and Public Welfare, has commented that, "I was surprised and a bit disturbed to learn of the ADA House of Delegates in approving a resolution against the utilization of certain kinds of auxiliaries." To the dentist who is satisfied with the current state and style of his or her practice, the specter of future events must surely be menacing. Why is all this change necessary, he or she might ask? Am I not doing my best for my patients? Indeed, he or she probably is. But, on the other hand, what of those in our communities who are unable to receive these professional services because of economic, social, psychological, geographic, or other obvious and not so obvious factors? Whether the variety of changes facing dentists will meet the needs and demands for services in the future is a matter of serious controversy between dentists of different persuasions, social planners, government agencies, third-party insurers, and consumer interest groups. Possibly the determination of whose perception is most appropriate must wait for the aforementioned chronicles 40 years from now. However, while we await the hypothetical judgment of history, we might consider the following questions. In a review of the changing climate for the delivery of dental services, has the dental profession been unable or unwilling to flow with changing events? Are we so certain that our current stand on many issues is best for both the profession and the general population? Or are we blinded in our own complacency with the status quo?
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.